Hi. It is important to recognize signs of mental health conditions and substance abuse with our students. The topic of mental health is very prevalent, and as we emerge from more than a year of the COVID pandemic, these will be good reminders for all. It is important to remember that all of us will have some of these symptoms once in a while. It is when behaviors become a pattern that significantly impact daily functioning that we need to pay close attention. Let's look at several categories of disorders and their symptoms. People with anxiety disorders respond to certain objects or situations with fear and dread. They have physical reactions to those objects, such as rapid heartbeat and sweating. An anxiety disorder is diagnosed if a person has an inappropriate response to a situation, cannot control that response, and has an altered way of life due to the anxiety. Anxiety disorders can include panic disorder or panic attacks and many phobias. Behavioral disorders involve a pattern of disruptive behaviors in children that last for at least 6 months and cause problems in school, at home, and in social situations. Again, nearly everyone shows some of these behaviors at times, but behavior disorders are more serious. Behavioral disorders may involve inattention, hyperactivity, impulsivity, defiant behavior, drug use, and criminal activity. Behavioral disorders can also include ADHD, oppositional defiant disorder, and conduct disorder. Eating disorders involve extreme emotions, attitudes, and behaviors involving weight and food. The most common eating disorders include anorexia nervosa, binge eating, and bulimia. Some of the symptoms of these disorders include an intense obsession with weight, a distorted body image, refusing to eat around other people, confused or slow thinking, compulsive exercising, loss of bone strength, and extreme sensitivity to cold. The most common mood disorders are depression, bipolar disorder, seasonal affective disorder, and self-harm. In general, most mood disorders involve feeling sad, losing interest in important parts of life, or fluctuating between extreme happiness and extreme sadness. Post-traumatic stress disorder is a real illness. You can get PTSD after living through or seeing a traumatic event, such as war, a hurricane, rape, physical abuse, or a bad accident. PTSD makes you feel stressed and afraid after the danger is over. It affects your life and the people around you. PTSD can cause problems like flashbacks or feeling like the event is happening again, trouble sleeping or nightmares, feeling alone, angry outbursts, and feeling worried, guilty, or sad. PTSD also starts at different times for different people. Signs of PTSD may start soon after a frightening event and then continue. Other people develop new or more severe signs months or even years later. PTSD can happen to anyone at any age. Mental health problems and substance use disorders sometimes occur together. This is because certain illegal drugs can cause people with an addiction to experience one or more symptoms of a mental health problem. Mental health problems can sometimes lead to alcohol or drug use, as some people with a mental health problem may misuse these substances as a form of self-medication. Mental and substance abuse disorders share some underlying causes, including changes in brain composition, genetic vulnerabilities, and early exposure to stress or trauma. Some of the red flags to watch for with mental health and substance abuse are a drop in attendance and performance at school, engaging in secretive or suspicious behaviors, unexplained change in personality or attitude, bloodshot eyes and abnormally sized pupils, sudden weight loss or gain, unusual smells on breath, body, or clothing, sudden changes in friends, hangouts, and hobbies, or an unexplained need for money. Suicide causes immeasurable pain, suffering, and loss to individuals, families, and communities nationwide. On average, 112 Americans die by suicide each day. Suicide is the second leading cause of death among 15 to 24-year-olds. Some of the signs of suicidal thoughts are talking about wanting to die or to kill oneself, looking for a way to kill oneself, talking about feeling hopeless or having no reason to live, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, acting anxious or agitated, behaving recklessly, sleeping too little or too much, withdrawing or feeling isolated, showing rage or talking about seeking revenge, and displaying extreme mood swings are a few of the signs to watch for. Take these warning signs seriously. If you suspect a student is considering suicide, contact the counselor on your campus immediately. Document in writing the behavior that led to your concern and follow up with your campus leadership team until you are confident that the student has the proper support. There are important steps we want to remember in our school system when looking for mental health and substance abuse symptoms with students. We want to ask your campus leadership team for the protocols for documentation and appropriate communication channels. We want to always communicate support to our students. With confidentiality, you need to make sure you work with the school counselor or campus leadership team. Especially with suicidal behaviors, do not assure a student that you will hold information confidential when it leads to self-harm. You would, however, ensure privacy and confidentiality with the student's peers and other faculty and staff that are not a part of the crisis protocol. There are many resources available on the web if you would like to continue learning about mental health signs and symptoms for students. The brief information that we've gone over today came from mentalhealth.gov. Thank you.